When a person's homeless, there are a lot of challenges to seeking health care. There are a lot of other competing priorities. A person's often just trying to figure out where they're going to sleep for the night. So seeking out health care is not a priority.
And when patients can't get the preventative care they require, minor medical problems become major medical emergencies.
Unhoused people do access preventive health care, but it's very challenging and difficult. And often we see people seeking care when their illness is quite acute or quite advanced.
A report released this week by BMC Health Services Research finds that homelessness is associated with substantial access healthcare costs, about 7 times more for unhoused patients than for housed patients. The average cost per year for housed patients is around $2,000, compared to around $12,000 for people experiencing homelessness.
Postponing access to primary health care or regular checkups, and it can result in the development of chronic illnesses. It can result in waiting to access healthcare services until it becomes an emergency, because there just isn't time when you're faced with the crisis of an everyday survival lifestyle. There isn't time to think about the long-term impacts of your health.
According to current shelter flow data from the City of Toronto, over 10,000 people are sleeping in the shelter systems every night.
Homelessness itself is really taking a toll on people's health and is having an impact on our healthcare system. And if we address the problem of homelessness, we would be helping people not only be housed and healthier, but we would be helping relieve the stress on our healthcare system.
A lot of folks will wait until something becomes obviously an emergency to access healthcare. They'll be accessing healthcare through the emergency department rather than through a primary care physician.
We reached out to the province for a response to this report, but did not hear back in time for broadcast. The report found that programs that resolve homelessness often prevent future cases with dire outcomes, while reducing costs and better meeting healthcare needs. In Toronto, Beverly Andrews, City News.